Christel, thank you so much for coming today and making time. I just wondered if we could start off with your project. Tell me a little bit about it.
Sure. Our project was the Therapies for Long COVID project. It was funded by the government, and it looked at the causes and symptoms of long COVID.
Oh, how interesting. And tell me, how did you innovate the patient and public involvement in this project?
So we had over 40 patient partners involved in the study, and they did two major things. The first one was to create with us a new symptom questionnaire for people with long COVID. So they created the questions, they tested the questionnaire, and the second thing was to again work closely with us to create a study to test some pacing resources to be used on an app.
Fantastic. And in a way, you've already answered the question how important it is for the patient and public involvement in this project, but within your own words, how important was it for you and your team?
It was massively important, and we could not have done it without them, to be fair. Their shared experience was invaluable, and it made our study a lot stronger. And anything from reviewing documents to creating the study with us, we learned so much from their shared experience, and they also learned a lot from each other as well, and they liked the peer support element as well.
Brilliant. Thank you so much for your time.
Thank you. This is Flick. Flick is one of our patient partners on the TLC study. Flick, could you tell us what your role was in the TLC study as a patient partner?
So I was working, overall my role was to give my opinion on various different things, so whether that was sometimes in the planning and the documents that were involved with the study, also with the symptom burden questionnaire, involved in making sure that that was accessible and relevant for those living with long COVID. And I think the other sort of main part of my role was looking at the interventions that were being included in the study, and again making sure that they were appropriate and accessible, and which ones were our preferred interventions.
Yeah. And what was it like for you to be a patient partner in the TLC study?
I think being a patient partner was really empowering, to have that recognition both of sort of the journey that we've come on and the understanding, the amount that we've learned from doing that, and the recognition that yes, the researchers were asking us questions, but they were asking them to understand better what was being lived, rather than in other settings where sometimes questions are being asked to doubt you. There was no doubting at all. I think it was just very beneficial as a step back into the real world, and being able to use our experience for something that's eventually hopefully going to be quite positive.
Yeah. It was good to see you share your experience with other patient partners as well. Would you have any advice to give anyone who would want to be a patient partner in research?
I think, as I said, sort of we've all gone through various different bits in our lives, and I think you're the expert of what you've lived and how easy, how difficult it was, what were the challenges, what were the benefits, and being able to share that with the researchers, make sure that the research is relevant for those who it needs to be. I think being honest with them helps make that accessible, that you can be able to contribute. So yeah, I'd definitely say do it and just be open and honest.
Brilliant. Thank you, Flick.
Thanks.